wanted to ask you a quick question before we dive into some of the details. One of the overarching questions that we've sort of been scratching our heads about. There's been a big push, especially by Senator Sanders and a couple of people who follow his politics, to expand Medicare coverage for things like vision and hearing and things like that. And I think we can all agree that Medicare coverage in those areas is perhaps very poor. But we can also, I think, postulate that there is both a right way and a wrong way to expand coverage for Medicare. Josh, if you were designing a program that would accommodate some of the things that Senator Sanders and his followers are asking for, what are your thoughts? What would be your policy recommendations to lawmakers and how they satisfy this demand for increased benefits, but at the same time make sure that Medicare is soundly financed?
Well, I mean, I could talk about this for hours and hours because it's something I've thought a lot about. But I think the main thing is we already have a program in Medicare that provides vision, hearing, and dental coverage. It's called Medicare Advantage. About 40% of Medicare enrollees are going to be enrolled in Medicare Advantage. And in those plans, about 90% of those cover all three of those things. So this option is already available to the Medicare population. And I think we can presume that the people that desperately need those coverages often pick Medicare Advantage plans just to obtain those. And the biggest problem here with the discussion over Build Back Better and which expansions should be included is that there was no acknowledgement of this. And so two of my big pet peeves here were that we were talking about adding those benefits into what we call traditional Medicare, but we weren't going to reduce payments to the private plans that already provide those benefits. And that is a very expensive thing to pay for benefits that are already being covered in those private plans. We were still going to send those private plans even more money, even though they're already covering it with the money that they get. And if you actually took that kind of additional bonus payment out of these Medicare Advantage plans, you could reduce the cost of expansion by half. So we probably could have expanded all three of those things and taken them out of the Medicare Advantage payments, and it would have cost about the same as just doing the hearing expansion is costing right now. So that was my big disappointment. And then the other thing, which I think Concord has been talking about for many, many years, is that Part B premiums for seniors do not cover all of Medicare. Your premium covers about 25%, which, is a great benefit for seniors. But here we were talking about adding these provisions onto Medicare without charging a premium for them. So the hearing benefits are being added to Medicare, but the cost of those benefits are not being added into the calculation of premiums. And that also makes no sense. So those are kind of, if we're just going to conventionally expand Medicare to include these benefits, at least we should be including them in the premium calculation, and we shouldn't be paying the private plans in Medicare Advantage for providing those benefits since they already do it with the money that they already get.
Yeah, that seems like if you're going to design something to make it the most maximally inefficient, expensive way to do something, that's how you would do it. What was the rationale behind that?
Bob, if I knew, I mean,
I guess let me
a one-word
something.
answer. Lobby.
Well, yeah. I mean, I guess it's that you can't ask anybody for anything these days, even if you're enhancing a benefit, which it just strikes me. I mean, particularly if it's going to be part of the Medicare Part B program, but it's not part of the Medicare B premiums, that doesn't make any sense to me. Is that a horrible precedent?
I mean, everything's a horrible precedent. But you're right. Like, I don't even. Yeah, I mean, maybe there's some political difficulty if Medicare Part B premiums go up, but they wouldn't be going up by very much and you would be able to tell seniors that for this very small incremental increase in your Part B premium, you now have dental, hearing, and vision benefits. I mean, it seems like a fair trade.
And so I was thinking that maybe the Medicare Advantage plans would maybe lose some people because they would not have that advantage of having a hearing benefit. It would be one of the advantages that they would have over traditional Medicare. But I guess that maybe if they're getting paid for it, something
Well, I mean, the thing that worries me is that we're already overpaying Medicare Advantage plans for covering beneficiaries. We're paying more to the private plans than we do to cover people in traditional Medicare. And this is going to be a huge fiscal problem going forward. We already know that Medicare is unsustainable, and this is going to just make that happen even faster than it would otherwise, because we're just continuing to pay private plans more per person, and the costs per person are growing faster than in traditional Medicare. And that situation is untenable. It's not directly related to Build Back Better, but it is something that we all should be worried about. And this was some really small opportunity to do a little bit more parity between traditional Medicare and Medicare Advantage. And I think the politicians were afraid to do anything that would even remotely touch Medicare Advantage, which that is a very bad precedent going forward.